Welcome to tonight's presentation on what to do if you feel like you have every thyroid symptom, but you've been told, of course, that your labs are normal. So as individuals enter, I wanted to go through some housekeeping. There is a chat box, so you can type in the chat any questions that you have, and I am happy to answer them as we go through the presentation, as well as we'll take some time at the end to answer any of your questions. I think this presentation will approximately take 30 minutes to 45 minutes, and then we'll leave some space for questions at the end as well. If someone could post something in the question box, that will definitely help me out, because then I can see where precisely those questions are going to come in. More chat. Okay, hello. Hello, everybody. Okay, perfect. So I can see your chat box. I'll keep this open, tucked away in the corner here. So as we go through, if there's something you don't understand or you want clarification on, or you want me to slow down and go through it again, type in the chat box. I'm definitely happy to go through it. Hello, everybody. Okay, so let's get started right away. 2 minutes past 8, so we're good to go. Thank you, everybody, for joining. Actually, before we get started, I would love in the chat for you guys to write down where you're from. I'm always interested to see where individuals are joining from. As well, do you have a thyroid condition? Or do you feel like you have the symptoms? That would be something I'm interested in as well. So while you're chatting in there, let's get started. So you are definitely in the right place if you feel like you're tired all the time. If you're experiencing hair loss, if you feel cold all the time. Where I'm from, our winters are very cold, so it's not ideal to not have good body temperature, especially from Canada. If you've experienced mood changes, so anxiety, depression, mood changes can be a symptom of thyroid dysfunction as well. It's often not considered. If you've experienced weight gain, so that would be a symptom of low thyroid function, or even weight loss that you can't explain. That could be an example of hyperthyroidism or high thyroid function. And oftentimes individuals are experiencing significant weight gain despite their best efforts at eating healthy and exercising. Unfortunately, many individuals are just told, eat less, exercise more. That is not going to be helpful for somebody who has an underactive thyroid. That can actually be detrimental to them. And we're going to touch base on why that is. And if you've ever been told that your labs are normal, even though you don't feel normal. So in my practice, we run a lot of blood work. We run functional testing as well, maybe urine testing or stool testing, but we always pair the results of your labs with how you're feeling. If you are still not feeling well, then we need to look further. Just because they're normal doesn't discount the way that you're feeling. Lots of individuals here from all over the place, which is really great to see. Timmins, lots of Ontario, Canada, all across the world here, which is awesome to see. Thank you guys for tuning in. So here's some disclosure, little things about me. I am a licensed naturopathic doctor in multiple locations. I have 2 private practices right now, and we consult all around North America with individuals. I am the creator of the Metabolic Reset Program, a program designed to help individuals lose 20 to 40 pounds in 6 weeks. There is nothing magical about the program. It's all about individualized care, accountability, and restoring the foundations for health. I cannot provide specific medical advice, so this is for educational purposes only, but if you have questions at the end, I'm happy to help or point you in the right directions. I'll be discussing some private lab companies, so if you're having a hard time getting access to labs, I will be discussing some private companies where you can obtain your own blood work as well, and I'm not affiliated with any of those labs. I am a huge component of informed consent, meaning the best health decision or the best health choice for you is one that you are informed with the benefits, the risks, as well as the alternatives. So in my practice, we work collaboratively with a variety of different practitioners to be able to say, here is the natural approach, here are the benefits, risks. Here's the pharmaceutical approach, here's the benefits and risks. None is necessarily better than the other. The best choice for you is the one that you choose and you feel confident with. And I'm also a mom of 2 and a dedicated homeschool teacher. I became a qualified teacher like many of you this pandemic, although I don't feel like I'm qualified at all for that. So let's dive into the thyroid statistics. So more than 12% of the US population will develop a thyroid condition in their lifetime. Canadian statistics are not as easily accessible, but it's roughly around the same. Women are 5 to 8 times more likely to have a thyroid disease. So that's 1 in 8 women. And what I often see in my practice is women will be told 2, 3, 5 years ago that their thyroid was normal, and then they're not checked again. And then they come to me 5, 10 years down the line and we're like, there's definitely something going on with your thyroid. So just because it was normal once doesn't mean that it necessarily is normal next year. So it's really important to get some testing. The really alarming statistic that I see is 50% of individuals who have a thyroid condition actually do not know that they have it. And they've been suffering with these symptoms, going to many doctors saying that they don't feel well, they don't feel like themselves, but yet they've been told that they're normal. And that's right for the American Thyroid Association. Throughout the presentation, I will be citing research, and all of the links to that research can be found in the last 3 to 4 pages of the presentation as well. You will get a copy of this presentation emailed out to you, as well as a recording at the end as well. So, why is the thyroid so hard to diagnose? It's often challenging to diagnose because no one symptom will rule out a thyroid condition, and there are not many symptoms that will rule in a thyroid condition. This is because the thyroid impacts every single organ system. Everything from, of course, your throat. The thyroid sits right here on your neck. So if you're experiencing difficulty swallowing, an enlarged thyroid gland, changes to your voice, that can be a symptom. Of course, it can impact your hair, skin, nails. So if you're noticing that your hair is falling out, or it's just not growing, it's brittle, or it's getting really tangled, that can be a thyroid symptom. Thyroid also impacts your digestive system. So increased bowel movements or decreased bowel movements can be a symptom as well, which can lead to other issues and changes with the gut microbiome or the bacteria in your gut. It can impact your thinking. So if you are feeling foggy, or you are thinking about a sentence, but you're just having troubles putting words to those sentences, like I am right now. Anxiety, fatigue, depression, those can all be symptoms of thyroid dysfunction as well. Increased or decreased heart rate, even feeling heart palpitations, or just feeling your heart beating in your chest, can definitely be a sign of thyroid dysfunction as well. It can also impact your sex organs. So we're going to talk about sex hormones, your estrogen, your progesterone, testosterone, and how those are related. The way I practice is I see all organ systems as interconnected. So we're not just looking at the thyroid in a thyroid suspected case, we are looking at everything, because it can impact your fertility, your menstrual cycles, sex drive, things like that, as well as it can impact swelling. So if you're feeling like your joints are swollen, or that you're feeling really puffy, or you're retaining a lot of water, that can be a symptom of thyroid function as well, and carpal tunnel there. So here's all the signs and symptoms that we just chatted about in a typed out form. So if any of these you're feeling that you're experiencing, you definitely want to get tested for thyroid, at least to rule it out. Now, normal does not mean optimal, and everybody's optimal range is going to be different. And we're going to talk about what proper testing actually looks like and what those optimal ranges actually look like as well. One thing that I didn't cover before is actually cholesterol levels. So if you're experiencing higher levels of cholesterol, you really want to look at thyroid as well. And this is where more testing is really necessary, because we want to figure out what is the actual root cause. So if you have high cholesterol, it's not because you're deficient in a statin medication. Sometimes those medications are necessary and needed for the right individual, absolutely, but high cholesterol is not caused by a lack of this medication. It's caused by something else. We want to look at everything: diet, hormones, as well as your thyroid gland. So what you will learn, you'll learn why you might be experiencing thyroid symptoms despite your labs being normal, and what an actual normal optimal lab looks like, how to properly test and diagnose thyroid conditions, and how to get access to that testing if you're struggling to do so, and what you can do today to improve your thyroid function from a dietary and lifestyle perspective. First thing that I want to do, and something that I'm really passionate about, is the education piece. So I want you to understand what thyroid hormones are and how to look at your own blood work to make sure that you're in the optimal range. So here's an overview of how the thyroid works. Like many hormones in our body, the thyroid functions on these negative feedback loops. So your brain, and it's the pituitary in your brain, will secrete TSH, thyroid stimulating hormone. When it senses you need some thyroid hormone, the brain will say, hey thyroid, can you make some hormone? Then the thyroid will produce T4 primarily, a little bit of T3, but mostly T4. That's an inactive thyroid hormone. That T4 then needs to be converted to T3, your active hormone, or it could be converted to reverse T3. And we'll talk about what that is and why you don't want to be going down that pathway. Now, once your thyroid produces enough hormones, it sends a negative signal back to the brain to slow down the production of thyroid hormone. This is how it should work. Most individuals, the only thing that's going to be tested is TSH. This just says, is the brain talking to the thyroid gland? It does not tell us if the thyroid gland is listening and producing adequate hormones. Now, when your thyroid is low, when you have low hormones, what typically you'll see is a high TSH. High TSH is when the brain is starting to talk a little bit louder. If you have kids, maybe you ask them nicely once and then your voice gets louder and louder and louder as you go. That's the same way that TSH works. So that will actually increase in hypothyroidism. So your hormones are low and TSH is increasing. Now that's not always the case, and we'll talk about some examples where that isn't happening, but this is an overview of the basic signals with the thyroid. So here it is in text form. In response to thyroid stimulating hormone from the pituitary in your brain, the thyroid will produce T4 and T3. And this sets the basic metabolic rate. Every cell of the body needs thyroid hormone. The thyroid gland produces both T4 and T3. T4 is about 5 times more abundant and has a longer half-life, 5 to 7 days. So you can think if you've been prescribed T4, which is Synthroid, it's not going to work immediately. It's going to take a number of days for that to get into your system. So its half-life is about 5 times longer than T3, but it doesn't bind very strongly to the cells and doesn't have a very strong response. So you can have great levels of T4, but you can still have the symptoms if you don't have enough T3. T3 is about 4 times stronger, but has a shorter half-life. So sometimes individuals who are on prescription T3, they're taking it multiple times a day because that half-life is shorter versus the T4. Does that make sense? Does what we're covering so far make sense to everyone? Can you just put a 1 in the comments if that's the brain signal to the thyroid is making sense to you guys? Okay, perfect, thank you. Now, what happens when your thyroid produces T4, that inactive hormone? How does it get converted to T3? It gets converted through something called peripheral metabolism. This just means other areas of the body, like the liver, the gut, the kidney, converts T4 to T3. You can have great levels of T4, but it just kind of sits around, doesn't do very much. So we have to convert it to get T3. Now, if we look at this picture here, this will show the differences in what T4 and T3 look like. All the difference is that there is an iodine group that's removed. So you can see there's 4 green balls on the T4 and 3 on the T3. So they're just pulling 1 off. This happens primarily in the liver. It can also happen in the gut and the kidneys. So this is, again, why we have to look at a whole body approach. So we can't just rely on the thyroid gland. We need to know how the liver, gut, and kidneys are functioning as well, because they're responsible for this peripheral metabolism. T3, you can see it still has 3 iodine groups, so it's very similar. Reverse T3 and T3 are very similar, but they're mirror images of one another. Even though they look the same, it's really a lock and key effect. So if that key is even, a mirror image, it's not going to fit in the lock and produce the response that we want. Back up a step. Okay, what is reverse T3? So we saw it looks the same, but it is a mirror image. It's a version of T3, but it doesn't fit that lock and it doesn't produce the signal that our body needs from T3. Having low levels of reverse T3 is as important as having enough active T3. And reverse T3 is not commonly measured, but we need to know the status of reverse T3 because that's going to compete with T3 and it's not going to produce the same response. The conventional range for reverse T3 is anything below 25, but I start to look at anything in the teens as being suspicious. You can directly measure reverse T3, and you can look at your T3 levels, and you want your optimal ratio to be more than 6. So again, you can have totally normal TSH, so your brain is saying, hey thyroid, produce thyroid hormone. If that's all you measure, you could have normal thyroid, it's completely fine. But what if you have really high reverse T3 and really low T3? You are going to experience the same symptoms of thyroid dysfunction, and you are going to be told that you're normal. So you really need to emphasize getting that full panel, getting that full picture. The great thing is, perhaps you don't need a thyroid medication if your reverse T3 is high, but there are other things we can do from a dietary lifestyle supplementation perspective to help lower that reverse T3. Why does your body produce reverse T3 in the first place? It's a normal byproduct of T4 metabolism. It's normal to have it. It's normal just like your T3. But in chronic states of cortisol, when you have too much stress hormone, you can be dehydrated. You could be on low-calorie diets. That's why chronically low-calorie diets start to slow down your thyroid function. And then you're just told, your thyroid's fine, eat less, exercise more. That's not going to work here. That's going to increase your reverse T3, and your overall metabolism is going to go down. Infections, chronic infections. We're going to talk about some of the gut infections in this presentation. Inflammation, so that's another one that I measure on labs. I want to see where your levels of inflammation are because that can slow down your thyroid function. Poor sleep, even skipping out on sleep or having sleep apnea, not having good restorative sleep can drive up your reverse T3. And again, you're told your labs are normal, but you don't feel normal. And your body does this to protect itself, right? So if you're under chronic states of stress or food is not available, your body's going to slow down your metabolism as a compensation to keep you alive and healthy. So what are the patterns of thyroid dysfunction? So here are the textbook ones, the main ones that we think of. Hypo, meaning low, is too low of thyroid hormone. But again, that TSH will be high, so it's the opposite because your brain is starting to yell at your thyroid gland, produce more hormone. Hyperthyroid is too much thyroid hormone. In these cases, your TSH will actually be low because if your brain senses that you have too much thyroid hormone, it'll slow down its voice. It'll say, oh, we don't need as much. Okay, that's from that negative feedback loop. The third textbook condition that we see are things like Hashimoto's or Graves. These are autoimmune conditions that cause either high thyroid or low thyroid. Hashimoto's is an autoimmune condition that causes low thyroid. Graves is an autoimmune condition that causes high thyroid. So what does this mean? It means that your immune system is attacking your thyroid gland. It's interpreting it as not self, or the receptors or the thyroid hormone, something like that. And in these cases, we measure thyroid antibodies. Thyroid antibodies can be elevated up to 10 years before your TSH becomes impacted. And you can definitely experience symptoms, all of the symptoms of thyroid dysfunction, if you have these elevated antibodies, even if your other markers are normal. So it's important to measure those as well. And again, going back to that whole body approach, we want to look at, well, what's going on with the immune system that's happening? For some individuals, there's a genetic predisposition. But we know individuals who have a family history of autoimmune conditions, not everybody develops one. You need that genetic predisposition, and then you need that trigger. So if we can figure out what the trigger is, we can work on preventing additional autoimmune diseases from developing. And a large portion of our immune system is actually residing in our gut. So we want to look at gut health here for sure. Here are some other thyroid issues that we're going to talk about. Secondary hypothyroidism. So this is not necessarily an issue with your thyroid, but an issue at the brain level in the pituitary. There can be issues with your peripheral metabolism, right? How your T4 is being converted to T3. You can have high levels of reverse T3. That can impact how you feel. Then there's also something called thyroid binding globulin. This is a transport protein that will bind onto your hormones and make them inactive. So you can imagine if you have too much of the binding, you're going to have thyroid symptoms. You're going to have low T3 symptoms. If you don't have enough binding protein, you can have hyper symptoms. And we're going to talk about some of the things that can influence thyroid binding globulin 2. And the last one is resistance to thyroid hormones. You can be having great TSH, you can have great levels of T3 and T4, but if your cells are resistant to it, that hormone cannot actually bind and produce the effects. Your entire panel will look normal and you'll have the symptoms as well. And this is really hard to identify. So it's one we always want to keep in mind for individuals who have all the symptoms. So what is this secondary hypothyroidism that we chatted about? What is this pituitary dysfunction? Well, the pituitary, again, that's the small pea-sized gland that sits in your brain that signals to the thyroid gland and signals to other organs as well to produce hormones. So you can imagine if you've had a concussion that has impacted this gland, it can change how your body's producing thyroid hormone. It can also change how your body's producing a lot of other hormones as well. We do know that chronically high levels of cortisol, our stress hormone, can impact this signaling and can cause this secondary hypothyroidism. Other issues like big swings up and down in your blood sugar can impact your thyroid gland. So things like insulin resistance, prediabetes, PCOS can absolutely impact your thyroid gland. These big swings in your blood sugar influences cortisol and create changes in the thyroid gland. So it really comes down to, again, that whole body approach. We need to know what's your sleep, what's your nutrition, are you being hydrated, what are your stress levels, measuring inflammation on your labs. We need to have a full picture so we can understand how to best support each individual who is experiencing these symptoms. Any questions there? Maybe put a 2 if that makes sense. Good, okay. So looking at this diagram again, we want to look at what is the key difference from primary, your thyroid just not making enough hormones, so the level here is an issue, versus secondary, which the issue is a little bit higher up in the pituitary. In secondary hypothyroidism, TSH is not the issue. The issue comes down to this pituitary is not able to sense the appropriate signals from the T3 and the T4. TSH is low because the pituitary gland is not producing enough because there's an issue at this level. So you could have normal T3 and T4 or low T3 and T4 because your signals are not properly being interpreted. So we have to look at everything. And this is where taking the time to do a full medical history is really important. So I always ask about concussions and traumatic brain injuries, car accidents, even a significant amount of blood loss during birth can impact your pituitary gland. And we also want to take the time to get to know each individual to understand what is the stress that's going on in their life that can be impacting them. How was their childhood growing up? Has that influenced the amount of stress that they're carrying today and how they're interpreting their world? Let's talk about T4 to T3 under conversion. So you can make great levels of T4. We can be giving you Thyroid or T4. Everything looks fine because we're only measuring TSH and you're only measuring T4 in some cases. But what if that T4 is not being converted to T3? Well, you're going to experience thyroid symptoms because, again, T3 is the one that binds more strongly to the receptors. So 80 to 90% of the hormones released from the thyroid is in the form of T4. So it's really important that that T4 is able to be converted. Underconverted, T4 to T3 can absolutely cause a variety of symptoms, many of which we talked about at the start. We want to, again, look at cortisol. We want to look at nutritional imbalances. So we'll talk about some of the key nutrients that you need in your diet or either supplementation to help with this conversion process. If everything's great, it's just a conversion issue, there's definitely things we can do from a diet and supplements perspective to help that. We also want to look at cortisol and inflammation. Elevated thyroid binding globulin, remember that is that binding protein or that catcher's mitt that binds onto the protein and makes it inactive. If all of your hormone is bound up by thyroid binding globulin, it's not going to be useful to you. And again, there comes all the symptoms. So if you have too much thyroid binding globulin, it's all going to be inactivated. If you don't have enough, there's going to be a lot free floating around, and that's where we get the variations in symptoms. And we also have to look at these reference ranges as there's a big gray in between. So just because you don't meet this cutoff point or this cutoff point for low or high thyroid, there's still this big gray in the middle that we can absolutely produce a positive impact on your overall health and your quality of life. We don't have to wait until you tip over each of these points to get treatment. Elevated thyroid binding globulin, binding onto your hormones, can be a cause of extra estrogen, so estrogen dominance. Symptoms of estrogen dominance might be migraines, fibrocystic breasts, heavy menstrual cycles. So we want to look at where are your estrogen levels? Where are you being exposed to estrogens in your environment? So plastics are a big one, so ditch the plastic water bottles. Have a look at your skincare. So there are many chemicals that are in skincare and fragrances that resemble estrogen in the body, and you can think our skin is our biggest organ. You know, if we're using hormone replacement therapy, the amount of estrogen creams or testosterone cream, it's small. So if you are taking a cream that has chemicals in it that resembles estrogen, you're putting it all over your body, that can definitely impact your estrogen exposure. For individuals who are not ovulating, or they're having irregular cycles, or they have PCOS, you're going to have a relative estrogen dominance, because if you're not ovulating, you're not going to produce the progesterone that helps balance the estrogen. And in the next presentation that we're running, we're going to be talking all about PCOS and these things. In addition, another way we can get exposures to estrogens is through birth control. So if you've ever been on birth control or you're currently taking birth control now, we can see elevations in these binding proteins, which can last for years even after you've removed the birth control. And for some individuals, they really never come down. So we want to definitely consider that before we are just handing out birth control to everybody and everybody. You can have decreased thyroid binding globulin. So this is exactly the opposite. If you don't have enough, you're not going to be able to bind up your proteins, bind up your thyroid hormone. It also binds other things like testosterone. So for individuals who have PCOS, they're not seeing as much binding of their thyroid hormone, not seeing as much binding of their testosterone. Again, this is not everybody. So we really have to test where you are to know exactly what's impacting you. It's not to say everybody with estrogen dominance has this, or everybody who's ever taken birth control has this. Everybody's unique and has different predispositions and different genetic tendencies. So we really need to test where you are now to get an accurate depiction of what actually needs treated for you. Here's another one. You need to make sure you are managing your blood sugar and managing insulin resistance if you want to have good, appropriate levels of thyroid binding globulin. So anybody who has resistant weight loss because of insulin resistance, or they're finding that they have PCOS or their blood sugar is creeping up, your thyroid absolutely can become impacted from that. And then we have to go back to key dietary strategies to help with the insulin piece. This is why individuals who are going through the metabolic reset program often see better results in their thyroid function after, because we are specifically dealing with the insulin piece. If you go on a nutrition plan that's very low calories for a very long amount of time, what we see is a decrease in thyroid function. So I don't recommend going on a very structured or strict or restrictive nutrition plan for any more than 6 weeks. Weight loss should be intentional, fast acting, shorter period of time, then give your body a break. So I always recommend altering between weight loss and weight maintenance, weight loss and weight maintenance, because it's really important to take that stress off the thyroid gland. The last one here is resistance to thyroid hormones. This is one that's very tricky to identify, very tricky to treat, because everything is normal. TSH is normal, T4 is normal, T3 is normal, but those hormones are just not binding to the cells. So for some individuals, this can be an inherited genetic disorder. For other individuals, this resistance comes from a higher body mass index. So if we can look at strategically treating the underlying root cause for weight loss resistance, thyroid resistance gets better. Acute illnesses, so if you've ever had a really significant infection, that can cause resistance to thyroid hormone, as well as chronic stress. So again, everything comes down to managing your stress levels. And just because you feel like you're managing and you feel like you're okay, doesn't necessarily mean that your cortisol is fine. So that's where testing comes into play as well. Reverse T3, we've talked about this one. This is that mirror image of T3. Again, if this is high, it doesn't matter that you have okay T3. It's going to compete and potentially not be able to bind as strongly, and then you have the thyroid symptoms. So we really need to look at the full thyroid panel and measure everything. So what is a full panel? A full panel would be TSH, T3, T4, and your thyroid antibodies. Some labs in the US will also measure free T3 and free T4. It's not as common to see those measured in Canadian labs. Thyroid antibodies suggest an autoimmune attack on the thyroid gland. This can be elevated up to 10 years prior to having any issues with your TSH. You do not need to wait 10 years just to cross that definition line to feel better. And that's what I often see and is really frustrating. Individuals are told year after year after year, no, we tested your thyroid, it's fine. No, it's fine. We run a full panel and their antibodies are off the chart. And there are things we can do to help lower those antibodies. We also know that there's an association between celiac, or individuals who cannot consume gluten, and autoimmune thyroid conditions. So if I see elevated antibodies, I'm also running a celiac panel or asking if one has been done. This is why individuals often benefit, or one of the reasons they might benefit from a gluten-free diet. Now, for someone who doesn't intend to be gluten-free for the rest of their life, unless there's a very good reason to be, running the celiac panel can be helpful, because then we would know if it's 100% necessary to stay away from gluten, or if it's something that we're just recommending. Is it a sensitivity or is it a true allergy? Keep in mind, for celiac testing, you need to be consuming gluten. If you are not consuming gluten at all and you test, your panel could come back negative. So that's a conversation I often have with individuals. Do you want to try a gluten-free diet? Because if you feel astronomically better with a gluten-free diet and then you wonder, hey, maybe did I have celiac? You have to go back to eating it for a long period of time in significant amounts in order to get an accurate result. So if you are kind of on the fence, I'm not sure if I want to take it out forever, even if I feel really good, just do the testing ahead of time. We also know that infections like H. pylori or Yersinia or Blastocystis hominis, small intestinal bacterial overgrowth, can be that trigger in individuals who have the right genetic tendencies to cause or to start an autoimmune process on the thyroid gland. So we also look at digestive health and potentially running a DNA-based stool test to measure these to see if it's impacting you. We also want to look at that binding protein. We want to look at estrogen, the inflammation, the cortisol, leptin, sometimes leptin, your hunger hormone, satiety hormone. If that's not in range too, we can see some issues with the thyroid gland. Insulin, that's our fat storage hormone, helps to regulate our blood sugar, testosterone, progesterone. All of this needs to be measured to get a real accurate depiction of what's going on. And yes, it seems like a lot, but everything is interconnected. So if we miss a piece to the puzzle, we could be potentially going for the wrong treatment plan. We also want to look at nutrients. Vitamin A, that helps thyroid bind to the receptor. Vitamin D, we know that vitamin D is important for the immune system. So if you have an autoimmune condition, we really need to know what your vitamin D levels are. Now, vitamin D is a fat-soluble vitamin, so you can overdo it. You can also underdo it. So knowing what your vitamin D levels are can help us determine what's the actual dose that you need, the safe dose and the most effective dose for you. Selenium is an important nutrient that helps with the conversion process. So it helps to convert your inactive T4 to your active T3. So for some individuals, we really want to emphasize selenium, especially if they're having a conversion problem. Selenium you can get from Brazil nuts, or you can supplement with about 4 to 6 Brazil nuts. Of course, that's not going to be as accurate and precise as a supplement, but 4 to 6 Brazil nuts a day will give you roughly 200 micrograms of selenium. Iodine is another important one. So if we remember back to the picture of those green circles, iodine is something that's important to build thyroid hormone. Now, iodine, is it good for individuals who have Hashimoto's or is it not good? It's really individual specific, and there's lots of controversial information out there. We just don't know. And every practitioner has their own opinion. So I would definitely work with someone and see if iodine's right for you before just supplementing. There is a huge problem right now with this so-called normal range. I've noticed in the last 5 years that normal ranges continue to get broader and broader, especially when it comes to thyroid, especially when it comes to things like iron. It's okay to be extremely deficient, in my opinion, in one province or one state, and it's not okay in another province. So being able to work with individuals from various provinces in Canada has allowed me to really question these normal ranges and look at what is actually optimal. You know, if you're ferritin, for example, a storage form of iron, if you're 5, you're okay in Ontario, but as soon as you go over to Saskatchewan, the minimum is 50. And that's a really big difference. Back to thyroid. In 2002, the American Association of Clinical Endocrinologists suggested that we narrow the range from 0.3 to 3. There are some states that are still using TSH upper limit as 10, which is extremely high. Your brain is yelling at the top of its lungs for your thyroid to produce thyroid hormone at that point in time. We really want to narrow that range. Here are some other examples of reputable sources who have suggested narrowing that range. In my practice, I look at anybody with thyroid symptoms. If their TSH or their brain signal is above 2.5, we start to investigate further, because your brain should not have to work that hard to get your thyroid to listen. Here's 2 slides. This will be sent to you. So this is the difference between the normal and the optimal range. One is Canadian, the other one is US based. Now, every single lab is going to be a little bit different in the measurements or the units that they're using. So you really want to work one-on-one with someone who can understand those variations, because there are slight differences in labs and reference ranges. In my opinion, thyroid antibodies should be negative. They should be very low. There should be no reason for your immune system to mount any attack on your thyroid gland. So I like to see those nice and low, and I like to see TSH tightened, and I want to make sure that the T4, the inactive thyroid hormone that you're producing, is being converted to T3. So don't stress about writing those down. Those will be emailed to you. In terms of thyroid testing, if you are not testing appropriately, you will miss an abnormal result. You need to make sure that you are running a thyroid panel in the morning. Up to 50% of low thyroid patients will be missed if they measure their labs in the afternoon, because TSH, that brain signal, can be highly variable. So always test in the morning. I recommend always test morning fasted. Keep it consistent for all your labs around 8 a.m. How you test measures too. Again, morning fasted, and test before you take your thyroid prescription. So if you are on a thyroid prescription, I don't recommend taking your thyroid prescription and then going right to have your blood work done. Your levels of thyroid hormone will be very erratic 1 to 10 hours after you take your prescription. So it's better if you take your thyroid at night, for instance, fine, you can test in the morning. But if you typically take your thyroid in the morning, which is what I recommend to individuals that I work with, you need to wait until after your lab. Do not test on days 10 to 20 of your menstrual cycle. You have higher levels of thyroid binding globulin during these days of your menstrual cycle. So I always recommend typically testing after this, so 7 days before your menstrual cycle, and keep it consistent. So you can't compare apples to oranges, as that saying goes. It always needs to be consistent. So if you were always following these recommendations, then you know that you're always comparing the same thing. Question about TPO antibodies. So TPO antibodies, or anti-TG antibodies, those are the 2 that we primarily measure for autoimmune thyroid conditions. I like to see them low. low, low, negative, nothing. If there's small amounts present, then we look at, do you have symptoms? If there's small amounts present and your other markers are abnormal, then we want to have a look at the immune system and gut health and why that's there, okay? Oh, in terms of days of your cycle, this is a great question. So testing on day 21 to 28 would be when you would test. First day that you bleed is the first day of your menstrual cycle. If you're a male and don't have a menstrual cycle, or your menstrual cycle is irregular, or you're in perimenopause, menopause, you can test anytime, that's fine. And there will be a recording of this presentation. Okay. Does that make sense with the days of the menstrual cycle? Day 1 is the first day that you bleed. So then you'd count all the way up to past 20, or you can go at the start. Because I'm often measuring other hormones that need to be tested 7 days before the menstrual cycle, that's when I'm recommending going. Now, if your cycle is a little bit longer, so instead of a 28-day cycle, if you have a 30-day cycle, you would just tap on 2 extra days. Yes, morning. Always in the morning, morning fasted. If you've had a hysterectomy, you can go anytime. Anytime is fine because you won't know. Free T4 of 12 considered optimal. It will depend on the lab and it will depend on your T3. So if your T4 is slightly low, because a lot of it's being converted to T3, and if you're feeling good, then fantastic. But if you're not feeling good, then we want to look. So other lab abnormalities that we commonly see with low thyroid symptom, high stress. So again, we really need to look at where are your cortisol levels, which are also measured first thing in the morning. First, when the lab wakes up or opens up about an hour after you wake up, 8 o'clock, get in, measure your cortisol levels. So if you're measuring your thyroid in the morning, you will measure your cortisol levels at the appropriate time. And stress doesn't necessarily have to be, oh my goodness, I feel really stressed. It could be lack of sleep, dehydration, chronic infections, gut infections like we talked about, nutrient depletion. So if you don't have enough nutrients, that's a stress on the body. If you're chronically cutting your calories, if you're over exercising, if you have high alcohol, high sugar, high processed foods, all of these are stresses on the body. So this is where going back to the foundations, a really strong foundation in helping with working with someone with your mindset, helping to stay accountable for your sleep and your nutrition. All of that's going to be really important. Protein. Protein in your nutrition plan is also really important for maintaining a healthy thyroid function. So many individuals are stressing about, I don't know how many carbs to eat. I don't know if I should eat fats. Are fats good or carbs good? I'm not sure what to do. And let's just put that on the side for a second. We all need protein. So instead of worrying about the nitpicking of carbs and fats, I want you to instead shift your focus to, am I getting enough protein? Protein should be the size of your palm, about 30 grams at least 3 times a day. Bare minimum. And I see many individuals when they come to work with me or they're working at the metabolic reset program, that's the first thing. They're just like, wow, I was not eating enough protein. If you don't have enough selenium, that's a really important nutrient to convert T4 to T3. That can impact your thyroid function. Inflammation can impair your thyroid function, so you can measure ESR or CRP on your labs to get an idea of inflammation. The goal needs to always be focus on the foundation, reduce stress, replace your nutrients, optimize your nutrition, reduce inflammation. In terms of what nutrition plan is going to be best, it's one that is specific to you. I often see individuals who are consuming healthy foods that are pro-inflammatory for them. So we really need to remove all potential sources of inflammatory foods for a period of time, then add them back in strategically one by one to see which ones are an issue for you. Many of you have probably heard about autoimmune paleo nutrition plan or paleo in general. That is fantastic. As long as it's sustainable, you really enjoy it, rock a paleo nutrition plan. But if you feel that that's something that you don't want to or are unable to sustain long-term, doing the process of removing things, then adding them back in strategically can be really helpful to say, hey, it's actually not X, Y, and Z. We don't have to keep those all out. It just seems to be these couple. Let's keep these out for now and retest them again later to see if you can tolerate them. And that's essentially what we do in the reset program. We remove all sources of inflammation, add them in strategically one by one, because we want to see what your body can get away with. All right, in terms of stress, my favorite thing is the Relax and Focus product. I'm not going to mention a whole bunch of products in this presentation, but this is one that I feel has really, really personally helped me lower that stress response. I know when I was diagnosed with a thyroid disorder, I cannot lose out on sleep. I cannot sweat the small stuff. I cannot stay in that fight or flight response, because then I'm cold. My energy is down. I'm feeling like junk. My hair gets tangled. So really focusing on the stress piece has been helpful. This just contains GABA, a natural calming, contains L-theanine, which actually comes from green tea, which is nice and calming, inositol to keep your blood sugar stable. It's one of my favorite products. Here's a really great, it helps me sleep at night. Yes, it helps me sleep too. A couple scoops of that before bed and you get a great sleep. In terms of factors, I love this diagram. I often share it a lot with my patients. Here are the key nutrients that you want to consider. One of the things that we do with individuals is we have them track their nutrition, and the app that we use will actually show all these nutrients just to make sure that you're getting enough in your nutrition. If not, it might be something really simple as, hey, you're not getting enough vitamin C. Make sure to add more fruits and vegetables. Have lemon, have a fresh squeezed lemon. That's a great source of vitamin C. B vitamins are really important. Iron's another really important one for thyroid dysfunction. I have so many individuals who have way too low of iron. Low iron can make you feel like junk. It can ruin your motivation. It can cause your hair to fall out. Energy goes down. You can experience heart palpitations, which makes you feel anxious. You can have issues with your thyroid function from low iron. I've had individuals, when I ask them, hey, do you crave ice? That is a symptom of low thyroid or low iron status. So we really have to look at iron as well. Zinc is an important one for this conversion. Pumpkin seeds are high in zinc. Pumpkin seeds, Brazil nuts, make a mix, have that. Or perhaps you'll need a supplement, depends on each individual. One thing that's often not considered too is there are many drugs that can inhibit the conversion of T4 to T3. So one that I want to really be clear here, it says iron supplements impair the conversion of T4 to T3. This is only if you take them at the exact same time. So you cannot take your iron pill with your thyroid pill, and you cannot take your thyroid pill with calcium, with fiber. You cannot take it with dairy products. You should take your thyroid prescription in the morning, empty stomach. So these, if you're on iron and you're like, oh my gosh, you just said that iron's so good, but now you're saying that it stops the conversion. No, it's only if you take it at the same time. Estrogens, so hormone replacement therapy or birth controls, can impact thyroid because of that thyroid binding globulin. There's other medications on here. So if you're recognizing some of the ones that you are on, you might want to consider measuring your thyroid function, or at least keeping an eye on it while you're taking these medications. Oh, great question. So looking at the difference between iron and ferritin. Ferritin is stored form of iron. So you can have iron in your blood, and then you have this extra storage tank. It's kind of like the money in the bank. So we want to look at both. We want to look at how much reserves you have. And ferritin, I like to see it at least 50 to 70 for a menstruating woman. If you're having hair loss, it needs to be greater than 80. But if you're looking at a conventional range, 5 is the lowest cutoff, and that's far too low in my opinion. That's your oxygen carrying, that's how you carry oxygen around your body. So brain fog, your ability to recover post-exercise, your ability to breathe, all of really important. Thyroid medications, I typically recommend always in the morning, the empty stomach, away from coffee, away from food for at least an hour. If that's not feasible for you, you can speak to your doctor about taking it at night. It's all about being consistent. Consistency is key. I wanted to zone in on the birth control here, looking at how this can impact your thyroid function. Birth control not only influences the thyroid binding globulin, but it also depletes key nutrients. So we know birth control depletes zinc, magnesium, and B vitamins. So if you're on birth control for its intended use to prevent pregnancy, perhaps you want to consider supplementing to make sure that these are not becoming low. Because zinc, again, is important for that conversion of T4 to T3. Birth control also can interfere with the production of thyroid hormones, interferes with that conversion. and then it can interfere with its ability to bind. Birth control also increases your risk of Crohn's and colitis, that's documented, so irritable bowel disease. It can also increase your risk of insulin resistance. So your ability to process carbohydrates and send the appropriate signals can be impacted. So if you have insulin resistance because you've been on the birth control pill for so long, that can increase your risk of prediabetes and resistant weight loss. We've got a really great question here about certain supplements for iron. There are some that are better than others. I personally like to use ferrous fumarate. There are heme iron available. Heme iron, yes, there is some studies showing that it's better absorbed. I use ferrous fumarate because I can make it compounded through a pharmacy at a higher dose. It's very well tolerated when it's compounded. I see very few issues with constipation with it. I see very few issues with abdominal upset. And at a high enough dose for a short period of time, it can absolutely raise your ferritin levels. We talked about the birth control pill binding up your thyroid hormone so it's less impactful. And every cell in your body requires thyroid hormone. So if you're using birth control to prevent pregnancy, fantastic. It's all about informed consent and understanding, here's what can happen with your thyroid, here's where the increased risk can come from, here's what we want to make sure that we're replacing nutrient-wise. We want to make sure that we're measuring your insulin to see if that's being impactful. We want to measure these binding globulins to see if yours are being raised astronomically from being on the pill. And then when you decide to come off the pill, again, we need to monitor to make sure that they're going down and back into function. Here are the things that we talked about. We talked about selenium, we talked about zinc. Here are some food sources. I'm not going to recommend specific dosages of supplements. I cannot do so without a one-on-one consultation because I don't know if that's going to be appropriate for you. But you can focus on these things from a food standpoint. Protein, again, make sure you're having at least a palm-sized portion of protein. You can use a free app like MyFitnessPal to just track, see, am I roughly around 100 grams of protein each day? If not, then look for foods that are high in protein just to bump that up. Maybe it's a quick fix. Protein is so, so important for lean muscle mass. It's so important for your neurotransmitters. I am a big fan of protein. If you can't get your protein in from food-based sources, this is where I would recommend supplementation. You cannot out-supplement a diet, right? A strong nutrition plan is going to be key. No supplement is going to magically be a replacement, but it can be a tool to supplement a healthy whole foods diet. I use aminoline. These are amino acids. It's a quick, put it in your water, drink it back on busy days. Pure paleo protein. This is a hydrolyzed beef protein. It's 70% collagen based, gluten-free, dairy-free, autoimmune paleo friendly. If you're not getting enough protein in, consider something like this. Key nutrients, we talked about iodine being controversial. Here are the studies that talk about the association between low thyroid function and vitamin D status. Here's the research that looks into magnesium and the importance for thyroid status. N-acetylcysteine is fantastic for lowering thyroid antibodies. It's also an anti-anxiety, it's an antioxidant, it helps with detoxification, thins out mucus, so it can be a great one for individuals who have sinus infections or allergies, and it's also a strong antioxidant for the lung. Really important one. B vitamins. Interestingly enough, there is a high prevalence, approximately 40% of individuals who have a thyroid condition have low B12, which is also important for energy. Here is one herb called ashwagandha, WITHANIA. This has really great research on it as well. So this is an adaptogen. It improves your resiliency to stress, and it can reduce cortisol. Improves insulin sensitivity as well. So for individuals who seem to get really tired after carbohydrates, or they say, you know, I can't tolerate carbohydrates, they don't make me feel good, or I put on weight right away with carbohydrates. It's not that carbohydrates are bad, they're just sending the wrong signals. So we don't necessarily need to say, oh, carbs are bad, banned forever. We just need to improve the insulin signaling. May improve the estrogen-progesterone ratio, can stabilize mood, and an 8-week study showed that there was an increase in both the active thyroid hormone T3 and T4. And while I cannot recommend an exact dose for you, I will link this article so you can see what the dose was. But again, this was 8 weeks. So you can't take this once and expect for it to make magical changes in how you feel. Again, I'll link the study so you can have a look at the dose there. Dietary changes. I do find from clinical experience that individuals who have thyroid conditions often benefit from a gluten-free, dairy-free nutrition plan, or an autoimmune paleo plan, or an elimination diet. So we talked about removing things that create inflammation, adding things back in. You can try that out. We really want to focus on keeping that blood sugar nice and stable because that insulin resistance can impact your thyroid hormone. And again, we want to make sure that we're getting into that rest and digest state. Individuals with thyroid function dysfunction are often really in fight or flight too much. So sit down, deep breathe, chew your food, make sure that you're digesting well. I do have a general outline for some recommendations of an example of what you could consume if you have a thyroid condition. So I will send out this meal plan. Gives you examples, gives you recipes. You don't have to follow it exact, but maybe there's a couple recipes in here that you would enjoy. There is things like bone broth that's high in glutamine, healing for the digestive system. The Brazil nuts because they're high in selenium. Really great healthy omega-3s in the salmon and the avocado to keep inflammation down and stabilize your blood sugar. So here's an example. In addition, I'll put in there an autoimmune paleo one too. So if you don't know where to start, I would start looking at sleep, stress, hydration, and a strong foundation in a healthy whole foods diet. So maybe you can find a couple recipes in both of these plans that you might enjoy. Okay. How to get testing. So you can get testing through a naturopathic doctor or functional medicine practitioner. There are nurse practitioners, medical doctors that practice functional medicine who are willing to run full panels like this. There are also private labs, yourlabwork.com, letsgetchecked.com, or you can ask your family physician to run these tests as well. And we use a variety of different labs in my practice as well for individuals. Here are all the pages of references. If you are looking for the dose of ashwagandha, it is the very first one here. And then there's a couple extra pages of references that cite everything that was talked about in this presentation. If you have questions, feel free to reach out. And the next webinar that I will be running will be on weight management in individuals with PCOS and insulin resistance. So you'll also get the link for that in your email if you're interested in joining. So if you have questions, let me know. I'll hang around for the next little bit answering them. I feel like I've missed a number here, so I'm going to go back. Can you have secondary hypothyroidism if you are on thyroid medication? For sure. So if you've had Graves or hyperthyroidism or thyroid cancer perhaps, and you've undergone radioactive iodine treatment to remove your thyroid, then for sure. Do you guys see my dog up there? This is like, in Ontario, we have kids at home, we're working from home, and now our dogs feel like it's okay to be on a table during a webinar that's live. Anyway, so yes, you can. Come on. So that's why it's really important to, again, test. And your TSH, once you start a medication, can take months. So we really have to give it enough time on the medication before we retest and change the dose. So I know individuals don't like to wait very long to feel better, so I'll start with a lower dose and then we'll recheck probably in 8 weeks. I like to push it to, just to make sure that we're giving it enough time to get into the body and to readjust before we jump to adding more on. We talked about the TPO. If you just got your period, that will be day 1. So in terms, this question is, when should you test your thyroid? So if you just got your period, that's day 1. You want to count up to day 20, 21, 22. 19 to 22 is completely fine. There will be a recording. I will send that out. Can kids have the Relax and Focus? Yes. So this Relax and Focus product is formulated for a 150-pound individual. 4 scoops a day, 1 to 4 scoops a day, depending on how exciting. After the presentation, considering the dog was on the table, I'll probably have 2 scoops of this so I can fall asleep. It helps with cortisol. It helps to stabilize your blood sugar. It tastes delicious. My kids love it. I'll add a little bit to a smoothie with a banana and ice. Banana and strawberry, it tastes fantastic. I've had individuals mix this with bubbly, the flavored water. It tastes really good too. So kids, yes, can have it. Is it possible for a thyroid issue to cause numbness and tingling in the hands and feet? Perhaps. That can also be a sign or symptom of a deficiency in certain B vitamins. So that might be something to consider too, that peripheral neuropathy. It also can be a sign of your blood sugar being too high. So you want to look and make sure that there's no prediabetes or diabetes going on in there. We talked about the difference between iron and ferritin. Thyroid medications I suggest in the morning. Could the use of birth control vary at different stages of a woman's life? Yeah, that's a really good question. So as women age, their predisposition to not manage stress as well goes up. Their ability to handle carbohydrates as well goes down. So you're not going to be able, or you're going to be at increased risk of things like insulin resistance as you age. So if birth control also increases insulin resistance, then having that later in life perhaps may have an additive effect. I'm not sure if there's any randomized clinical control trials actually looking at that, but we do know that taking birth control can absolutely impact your blood sugar. I've heard that if you have a thyroid problem, fasting or diets are not recommended. So we talked about reducing calories is a stress on the body, which can increase reverse T3 and slow down your thyroid function. So when I was developing the metabolic reset program with the understanding that 50% of individuals who have a thyroid condition don't even know about it, I was measuring thyroid function week to week. And that's why I only recommend 6 weeks of strategic nutrition plan to promote weight loss and focusing on the underlying root cause of why the weight is there. For many individuals, it's not because of lack of effort. It's not because of, not trying healthy nutrition. It's not because they're not wanting to do movement. It's the underlying root cause issue for it. So intermittent fasting and a strategic nutrition plan that is not just cutting calories. It's looking at how is it supporting insulin? How is it supporting inflammation? Are you managing your stress? Are you focusing on sleep? Are you getting enough micronutrients? Are you supporting your liver health? As long as you're doing that and you're condensing into a 6-week time period, it's completely fine. So when I was measuring thyroid function, it wasn't until approximately the 8th week that I started to notice a slight decline in thyroid function. That's normal. If you reduce calories, your thyroid function will go down. You want to mitigate that as much as possible and go back and forth between losing and maintenance to give your thyroid gland a break. If not, you're just going to cut calories, cut calories, cut calories, cut calories until it's not sustainable. And that's not what we want to do. Yep, you can do fasting, no problem, as long as you're still getting all of your appropriate nutrients. High cost for these tests. So it depends where you are. Certain provinces working with me, I can have them run under certain healthcare providers that would be covered through your provincial health plan. So I work collaboratively with professionals, so that can be done. In terms of thyroid, like a full thyroid panel, you're looking at probably 90 to 150-ish to have that done. Hashimoto's can absolutely affect your chances of getting pregnant or your risk of miscarriages. So it's really important to measure those thyroid antibodies if you have had infertility or miscarriages, because you definitely want to support that during your pregnancy. And there is literature out there showing that supporting the thyroid gland appropriately can help improve pregnancy outcomes. The dog, I know. Thank you guys for your positive words. Relax and focus being pregnant. There is no research that specifically looks at the ingredients in Relax and Focus that shows that they are safe in pregnancy. So because that data does not exist, we just don't know. So in pregnancy, we're very, very careful. I would say we just don't know. So maybe not, probably not. Recording, yes, I will send a recording. Swelling and puffiness, so it depends. Look at why that might be. Measure your levels of inflammation, measure your progesterone and your sex hormones, because that can influence it. Measure your blood sugar, measure your thyroid. If they come back normal, amazing. We want to see that normal. We want to check off the box. We want to understand where that's coming from. Are you on medications that could be increasing that? How is your electrolytes? There's lots of things you can look at for swelling and puffiness. Did you have an injury? How do you book with me directly? You can type in the comments below. My website, breannekallonen.com. There'll be contact information there. info@wildsidewellness.com, or you can send me a message. I can send that over. You did your blood work at 2. I think that would be warranted to run another full panel first thing in the morning. The other thing that I didn't cover, I'm not sure why it wasn't in the presentation, or maybe I missed it. You cannot take biotin, a B vitamin that often is used for hair growth. You cannot take that 2 to 3 days before testing your thyroid. Look at if you're using a protein powder as a biotin in it, hair gummies, multivitamins, you have to stop biotin. It can really impair your results and make it look normal when it's not. Many women who have a thyroid condition are looking for ways to improve their hair, and they see biotin, they take a whole bunch, and then their labs look normal when they're not. In terms of how do you look for secondary hypothyroidism, is your pituitary gland working? If your pituitary gland was not working properly, you could see changes in the other hormones that the pituitary influences. So look at your cortisol, your estrogen, your progesterone. You want to look at TSH, T3, and T4. So it's really important to say, okay, is the pituitary working and making enough TSH? If not, where are your T3 and T4? So you kind of have to look at everything to be able to determine if it's a pituitary issue or not. I started on birth control to help with heavy periods. Could this be affecting my thyroid function? Yes, right? Because birth control, depending on the type that you're on, can increase that thyroid binding globulin so that you have not as much thyroid hormone going around. It also can increase your risk of insulin resistance. So if you're feeling particularly sluggish after meals, or you're really hungry, or you're hangry, kind of highs and lows in your blood sugar, that shaky, oh my gosh, I need food now, food cravings, that could be an insulin piece. Perhaps we know birth control can influence that. These tests definitely can be run through OHIP, Melissa. I work with a nurse practitioner, so we can get them through OHIP if indicated. If not, and we're just working together, I mean, I can run them privately anywhere from $90 to $150. Yes, we talked about supplements. You don't necessarily need to stop all of your supplements. It's really biotin that we want to stop. And I wouldn't take any supplements the morning of your lab, right? Don't take a B12, don't pop a B12 under your tongue and go get your labs done. If they're measuring B12, they're like, oh my gosh, your B12 is so high. It's like, no, you just took a B12 before. Biotin and prenatal vitamins, I would stop them 2 to 3 days before testing for sure. Are there safe levels of biotin to take? The interesting thing with biotin is research on biotin showing that it's beneficial for hair is really limited to individuals who are deficient in biotin. You would know that you're deficient in biotin because you'd be losing hair everywhere, your head, armpits, other areas that we have hair, that eyebrows, that would be gone if you're biotin deficient. So the research doesn't necessarily support the use of biotin as much as it supports looking at your iron, your stress, your inflammation, your thyroid hormones. I would look at all of that. You need to stop biotin 2 to 3 days before testing. So I hope that was helpful for you guys. I will work on this recording so that you can get the recording tomorrow in your email. It says 1 day after. I don't know if it's going to be tomorrow morning or 9 p.m. tomorrow. Within some time, you will get the recording of this. You will get the handout to look at the nutrition plan. You'll get information about where to go get testing if you want it, information about how to work with me personally if you want to do that, and any other questions that you guys have, reply to that email. I'm happy to help. So I hope that was informative for you guys. In about 2 weeks' time is going to be the next presentation on PCOS. Even if you don't have PCOS, it'll be interesting for you because we're looking at blood sugar, which is the underlying root cause issue of insulin resistance. So that one will be there too. resistant weight loss, PCOS, insulin resistance, prediabetes is all what's going to be covering next time. And I'm super excited about that one. So I hope you guys have a wonderful evening. Thanks you for tuning in and staying to the end. And we'll see you next time. Talk soon.